Cystic Fibrosis Foundation Compass presents Navigating CF, a series of informational videos for people with CF, their families, and caregivers. This video will help you understand the importance of provider networks when it comes to coverage of CF care and how different types of health insurance plans might affect that coverage. You'll find additional videos and more information in this Health Insurance for CF series on the Navigating CF playlist. A network is a set of doctors, hospitals, clinics, and pharmacies, and other providers that have a contract with a health insurance plan to provide care at a reduced cost. If you choose to go to a provider who is out of the network, your cost responsibility will be much higher, or your plan might not cover the costs at all. Before you enroll in a plan, find out if your care center, doctors, and pharmacies are in the plan's network. Don't forget about other providers such as your primary care doctor, OB/GYN, transplant facility, or other specialists. Plan networks can and occasionally do change mid-year, but there are steps you can take to continue to see the providers you need. Connect with your CF Care team or Compass to find out more. It's also important to understand coverage for other components of CF care, such as labs, durable medical equipment, inpatient stays, and other services or treatments you need for complications, such as CF-related diabetes. You'll find out what is covered, to what extent, and at what cost in the plan's member handbook, sometimes called the Evidence of Coverage or Plan Policy document. This detailed information is especially important when considering the complexity of CF care and its coverage. The Summary of Benefits and Coverage, or SBC, is also a helpful tool. Think about what services you might need in the coming year. Be sure you know what the plan will and will not cover. Most important, be sure you look not just at the costs, but at the benefits to get what you'll need. Most insurance plans will be one of four types: a health maintenance organization, or HMO, a preferred provider organization, or PPO, a point of service, or POS, or an EPO, short for exclusive provider organization. The type of plan you choose will affect which providers you can see, where you can receive care, and how much that care will cost. Let's look a bit more closely at each. Health maintenance organizations, known as HMOs, have a very specific network of doctors, hospitals, and other healthcare providers. HMO plans do not provide any coverage if you choose a provider outside its allowed network. In an HMO, you must choose a primary care physician and see that doctor to get a referral to a specialist, such as your pulmonologist. PPO is short for Preferred Provider Organization. This type of plan also has a network of healthcare providers, but you have more flexibility to choose providers outside the plan's network at a higher cost. You do not need a referral to see a specialist. You may pay more in premiums for this flexibility. Point of service, or POS plans, combine different elements of HMOs and PPOs. You must choose a primary care physician, but you can also go outside the provider network at a higher cost. EPOs, or Exclusive Provider Organization plans, combine the convenience of a PPO but the limited network of an HMO. With an EPO, you have the freedom to choose any network provider, including specialists, without selecting a primary care provider, and no referral is required. But EPO plans do not cover services from providers that are out of network. As the name implies, a high-deductible health plan has a higher deductible for individuals and families than other plan options. High-deductible health plans are often paired with a tax-exempt health savings account, or HSA. An HSA is a personal bank account to help you save and pay for healthcare services and medical expenses with a debit card or check. The Internal Revenue Service sets the deductible requirements for the HSA and also limits how much you can put into it each year. You can find more information on irs.gov. Other types of savings accounts for healthcare-related expenses include flexible spending accounts, or FSAs, and health reimbursement accounts, or HRAs, if offered by your employer. All of these plans have different requirements and different costs, but one thing you'll find in every plan is their policy regarding in-network and out-of-network providers. You'll find more detailed information and resources about provider networks and the types of health insurance plans on cff.org/insurance and in other videos in this series. And remember, Compass case managers are ready to help you work through the confusion of plan types and provider networks. Connect with us whenever you need help.